It's been more than 100 days since 18 people were shot and killed in Lewiston. Since then, the community has been trying to make sense of how this could happen in Maine. And lawmakers are looking into ways to prevent this from happening again. During Governor Janet Mills' State of the State address last week, she laid out specific proposals to change Maine's mental health system.
News Center Maine's David Guilford spoke with providers who do this work every day.
I want to expand behavioral health services, particularly for those in crisis.
Governor Mills devoted part of her State of the State address to call for increased mental health resources, specifically care centers.
So I propose that we establish a network of crisis receiving centers across Maine so that any person suffering a mental health crisis can get prompt and appropriate care.
Hannah Longley is the clinical director of crisis intervention for NAMI Maine, a leading provider, and she lauded the idea.
It is an amazing, wonderful model that we have been supporting and been encouraging and been advocating to bring to the state and every county so that there is that accessibility at the community level.
Despite the push coming after October's shooting, she said, providers are grateful whenever a spotlight is placed on mental health to improve Maine's systems.
We have much more growing needs since COVID. And with the tragedies in Lewiston and other places in the state, the need has just astronomically grown.
Mallory Shaughnessy from the Alliance for Addiction and Mental Health Services explained how the legislature has already done some of the hard work. She pointed to 15 mental health care and worker bills passed unanimously that now sit awaiting funding.
We have seen the investment in this, community crisis response just decline and decline over the last decade. We need to have more funding.
Using not just attention, but resources to improve Maine's mental health network, these experts argue, will benefit all because, statistically, we will all need them at some point.
But the more we normalize these conversations, the more we open up access and the more we build up these strong, robust community resources, for all of us, the more our whole entire state and community is going to be healthy.
David Guilford, News Center, Maine.